Hi, my name is Neda Nikpoor. I'm a cornea, cataract, and refractive surgeon in Honolulu, Hawaii. Currently, cataract surgery is more exciting than it's ever been before. I think we have more technology available to patients and we have safer technology than we've ever had. Complication rates are extremely, extremely low, and the technology that we have available to patients now offers them a chance to improve their vision, not just their best corrected vision, but their uncorrected vision with less side effects than we've ever had before. So I think it's a really exciting time. It's also, since we have really great fluidics with phaco machines nowadays, the cataract surgery safety is so much improved from what it used to be. And so we've gotten to the point that we're actually able to offer cataract surgery electively to patients with refractive lens exchange. And that's definitely a testament to all the progress that's been made over the last couple of years with studying intracameral antibiotics and improvements in viscoelastics and all the different things that we have that now make cataract surgery so safe. So I think it's definitely an exciting time in cataract surgery. So that's a really great question. There are a couple of things that are happening with intraocular lenses, especially in the US, that I think are really exciting. So the kind of chronologically in order of the things that have happened, the first thing that was really kind of groundbreaking and game-changing in IOL technology was when we got the first trifocal lens in the US. So the PanOptix completely changed the game for a lot of cataract surgeons who weren't necessarily comfortable putting in advanced technology lenses. It's now taken some of the art out of refractive cataract surgery to some extent, where you no longer have to mix and match, a low ad multifocal and a high ad multifocal, or a EDOF and a multifocal. You now have astigmatism correction built into the lens, which wasn't always the case with some of the diffractive IOLs before. It's also really amazing in that both eyes binocularly see all three ranges of vision: distance, intermediate, and near. And so it really makes it a lot easier for surgeons to just bilaterally implant the same lens and know that if they've done a good job with their patient selection, then that patient's going to see well at all three ranges. The other really nice thing about trifocal lenses, and especially this one, the PanOptix, which is our first one in the US, is that there is less reduction in visual quality and less distortions or aberrations or side effects in terms of dysphotopsias at night, glare, halos, things like that. So the side effect profile of the lens is definitely better than any of the lenses that came before it in that sort of category of diffractive IOLs. And the really exciting thing is that it's the first trifocal of many to come. All of the companies are working on their own trifocal. J&J and B&L are working on them, and hopefully we'll see many other trifocal lenses come to the US. So that's the first lens that I think is really exciting. And then, at least chronologically in our practice, the next lens that we added was the light adjustable lens. And the light adjustable lens by ArcSight is just incredible technology that sounds like science fiction. And whenever I explain it to patients, they get super excited. Obviously great for post-refractive patients because, we can put in the lens and we can adjust it. And as you know, it's much more challenging to hit your refractive target in patients who've had previous LASIK or PRK, especially older generation lasers that caused a lot of higher order aberrations and irregularities of the cornea that make it really difficult to calculate your lens power. Especially this has been really useful for RK patients. And so several RK patients now that have amazing outcomes with excellent uncorrected vision that would not have been possible with a fixed power lens. And this is really just the tip of the iceberg with the light adjustable lens, because the company is working on a couple of things that I think are really exciting. And one of the things that's coming out very soon, hopefully this summer, is there's something called Active Shield, which is basically a UV blocking coating that's on the surface of the optic, on the surface of the IOL, that initially is going to just provide redundant protection so patients don't have to worry so much if they're not wearing their UV blocking glasses. But there's actually a study that's been done in Mexico at Arturo Chayet's practice where they did about 200 patients, and those 200 patients with Active Shield didn't wear the glasses at all. And they had the exact same outcome as other patients in glasses. And so that's really exciting because even though patients don't really mind wearing the UV blocking glasses, it's going to be really nice to be able to just take that variable out of it altogether. And that'll give us, more time to do the first adjustment and then kind of postpone and let them heal, let them stabilize for a month or two or even longer, and then come back and do the adjustments later when they're totally stable and ocular surface disease has been eliminated, any wound remodeling, all of that's been eliminated. So that's super exciting. They're also doing an EDF study. So they're working on extended depth of focus, and it's pretty exciting that at least in the short term, we can look forward to having a little bit more range of vision. It already, because of the optics of the lens, because of the negative spherical aberration in the non-dominant eye, and even in the dominant eye, they already get some increased range of vision compared to a standard monofocal lens, like really quite amazing extended depth of focus already. But the study that they're doing will even enlarge that range of vision. And so hopefully one would assume and one would hope that they're eventually gonna find a way for us to add maybe multifocality and then remove multifocality, which would be really amazing, because it's kind of a hard thing to explain to a patient what to expect. And, we do our best, but every once in a while, maybe, 1% of the time, there's somebody who just really doesn't like diffractive optics. And if you had the ability to just erase it with a light treatment instead of going in and doing an IOL exchange, I think it would take a lot of the discomfort away from both patients and surgeons. And then hopefully this would open up this technology for more patients and help more patients. The final thing, the third lens that I think is really exciting, that is really, I think, just the first in a whole new class of IOLs, is the Vivity lens. So Vivity and Eyehance both, in kind of a different way and to a different degree, extend the range of vision or the depth of focus in a monofocal optic, basically. And so the quality of vision is preserved, the contrast sensitivity is preserved, and this really allows patients who have some pathology or drive a lot at night and don't want to accept any of the side effects of a diffractive IOL. This really opens up some added benefits, some increased range of vision for patients who would have otherwise just not been a candidate for an advanced technology IOL. And this has been really exciting for patients in our practice who have, maybe some glaucoma, maybe abnormal corneas from anything, scarring, trauma, refractive surgery, whatever it may be, and severe dry eye, like any of those things that would kind of give you pause when looking at doing a diffractive IOL. The Vivity and Eyehance and future lenses will definitely make it more available to patients and get more patients free of glasses, hopefully.